Well, folks, it's 11:01. It's 1 minute past the top of the hour, so I'll get started. I just wanted to say thanks for joining. I think this is our 12th Zoom of the year. Today, our guest is Parag Shah. He's a pharmacist who works at a pharmacy in the South Etobicoke's Lakeshore neighborhood. He will speak to us about some services that are available at the pharmacy that we may not know about. Safe medication use, some government programs, and ways that the pharmacist can help us manage some common health conditions and day-to-day tips. Um, we're going to, as a bit of housekeeping, we'll do what we usually do, which is mute folks during the main presentation. You're welcome to submit questions in the chat, and towards the end, we'll have a bit of a Q&A. There may be a few places in the presentation where we'll solicit feedback, and you're welcome to respond via the chat or unmute yourself and make a response. With that, I will turn it over to our guest presenter, and that's pharmacist Parag Shah.
Thank you so much. Appreciate the invitation. Good morning, everyone that's here. My name is Parag Shah. I'm a pharmacist, and today we are going to be talking about your pharmacist and basically your partner in better health. So I really do sincerely hope that this is an informative session. Some information may already be known, but I think after this, everyone should and will have a very good idea of what to expect from their community pharmacist. So the goals of this session, I just whipped this up. Basically, like I said, at the end of this, I feel that everyone should already know what their pharmacist can do. And my job today is to kind of update you and reiterate and just remind on the important services and functions that your pharmacist plays and how it can better meet or help you meet your health related goals. I'll also discuss briefly the eligibility for some of these services. Namely, it's based on age. We're all here in Ontario, so we all have a valid OHIP card and number for the most part, so we should be fine. That's all you really need. And so I'll talk about that and hopefully inspire you to know your pharmacist. Everyone should know or have a home or family pharmacist, just like we have a family doctor, a family dentist. I do tell my patients that, we should have, or you should have a family pharmacist too, that you can reach out to and know quite well. Okay. So a little bit about me. I'm a pharmacist. I'm a 2010 U of T graduate. Seems like ages ago, but I really love what I do. And currently, I'm a designated manager at the Medicine Cabinet Pharmacy in Etobicoke. And so, if you're there in the area, please come by for a hello. I would really appreciate that. I am also, apart from my full-time gig, I am a course coordinator and instructor at SolarX Pharmacy Review Programs, which is a healthcare education company that provides courses and support for pharmacists and students across Canada to achieve their goal in licensure. I also have had some past involvement in teaching and preceptorship with the University of Toronto's Faculty of Pharmacy. And generally speaking, I look, I tell people when they walk into the pharmacy that no one enjoys seeing their doctor, or no one comes in, skipping down the road trying to get their prescription filled for the most part. So I, as a pharmacist, think it's important for us to make this entire process as effective and cordial and professional as possible. So I'm passionate about patient education, medication safety, and just general empowerment of people to take an active role in their health. Okay. So before we get to the actual content of our session, I just want to mention some important notes before we truly begin. I want to make it, I want to take a moment to clarify something important where this presentation is meant to be informative. Like, I am a healthcare professional, and everyone here has some sort of personal story when it comes to medications. They may be taking medications, and you might have your own questions. So my purpose here is to help you understand what pharmacists do, what services we can provide and offer in Ontario, and how we can help you achieve your goals. So unfortunately, I won't be able to answer any personal medical or medication related questions. So I would just encourage you to, if you were to ask any questions, keep it general so everyone can appreciate the question and the answers provided. Um, I encourage you to speak to your own pharmacist and your doctor or health provider if there's any specific questions. Okay, so just want to mention that. I whipped up this comic, and I thought it was kind of a nice way, kind of a funny way to kind of illustrate the evolution of pharmacy practice in Ontario and really actually probably across the world, especially in North America and probably the western part of the world. But in the 50s, as you can see here, or even just in the past, it was all about the medication, right? You went to your pharmacy, you got your medications, and that's it. And that's kind of what happened for a long time. And then 2010 came along. That's actually when I graduated in 2010. And I still remember when flu shots were offered for the first time. And in our realm, it was kind of earth shattering. It was a really big, moment for public health. You can imagine how many doctors' offices, nurse clinics, and nursing clinics there are out there versus how many pharmacies there are in Ontario. There are thousands.
Mm.
So with this new expanded scope basically means what we're able to do. So with this new expanded scope of pharmacists, we were able to, on multiples, increase our reach and access. So that's important. Right now, we're in the thick of flu shots. I'm sure some of you, hopefully all of you, received and got your flu shot at your pharmacy or doctor's office or nurse practitioner's office. But this increased our access tremendously. Then we fast forward to the 2020s, and kind of in a cheeky way, I said that in that little comics panel, here's a diagnosis, your follow-up plan. I did your blood work that I drew while checking your blood pressure. So we're doing it all. And hopefully you don't have this where your doctor's office is 6 months from now. But that's kind of an extreme, kind of lighthearted joke. Um, what is the point here? What I'm trying to illustrate is that, and this is happening actually in other professions as well, but the government understands empowering other professionals, such as pharmacists, will help free up time, reduce the burden that doctors are currently facing. So, unfortunately, it's not uncommon to hear that you may have to wait 1 to 2 weeks just to see your own family doctor, or that there are no walk-in doctors able to even take in walk-ins if you need to see someone a little bit sooner. And even worse is we don't even have a family doctor that we can rely on. What's happening currently with my own patients, I'm noticing, is that a lot of physicians are retiring. And when they're retiring, we don't really know what's happening with their patients. So that's an unfortunate thing. Not to say that this and other services pharmacists provide other professionals, it's to replace doctors. By all means, that is not what's happening. It's to complement and help. That's the bottom line. Okay? So, why this matters? Hopefully, everyone agrees here that pharmacists are the most accessible healthcare professional. Do you need an appointment to walk into a pharmacy and ask a question? No, we don't. You can actually pick up the phone and call your pharmacy and ask a question. So therefore, it's quite evident that we're the most accessible healthcare professional. Now, if you notice here, I put a little star beside no appointments needed. Now that pharmacists can provide a lot of different services, in some of those cases, we do recommend or ask that you make an appointment. But generally speaking, to see and talk to your pharmacy, you don't need an appointment. Many seniors visit the pharmacy more often than doctors' offices. This is a fact. I can tell you, for example, when a patient comes into my pharmacy and they're getting a refill, and I know my patients, like the back of my hand. So when they're walking in, I know that, for example, Mrs. Jones is coming in to get her blood pressure medication. So I take a moment just to ask, Mrs. Jones, how are you? I see that you're picking up your refill for your blood pressure medication. How is your blood pressure going? What kind of numbers are you getting these days? Are you monitoring your blood pressure? Did you have any questions? So every moment that someone walks in, we have a chance to touch base with them. That's another important reason for you to know your pharmacy. Now, I want to mention something. The way I conduct my practice and my workflow at my pharmacy can be different than other pharmacies out there. I'm not going to comment on the flow and how busy things can become or staffing and so on. But in theory, everyone should be able to get this kind of experience. Pharmacists can now offer more services than ever in Ontario. It's an exciting time. And we'll get to that in more detail later, but we can do a lot of different things, which I will expand upon. So everyone here knows what you can get at your pharmacy. So the point of this is that knowing what services that pharmacists can provide will help save time. You can get timely health care, and you will just be able to reach your goals in a more timely fashion. So that's the plan. All right. So let me ask you guys a question just to kind of get the juices flowing a bit. And please feel free to use your chat to answer. In Ontario, which of the following can a pharmacist do? A, without talking to the doctor, prescribe for minor ailments like pink eye or UTIs. B, provide vaccinations and injections. C, extend or adapt prescriptions even if the doctor is not available. D, offer advice on over-the-counter products and vitamins. Or E, all of the above. For those of you here, why don't you just write your options here, or what you think the best answer is. Thank you for everyone that's
I'm
participating.
just typing mine in the
Oh,
chat.
Yeah,
nice.
I would say E. Yeah.
Yes. Yeah, I mean, you can kind of, this is not meant to be challenging by any means. Like, I'm sure all your examinations and test taking days are done. But this is just to kind of get you thinking a bit.
Sure.
Now, I think most of you agree that we can offer advice on OTCs or over-the-counter products. Probably all of you know we can provide vaccinations. So just based on those things, that could most probably be E. However, without talking to the doctor, I don't know if you guys know this, but let's say you got a prescription and there's some sort of issue with it, or there is another way that might be better for you to take the medication. Normally, or in the past, what we had to do is contact a doctor, fax the prescriber, wait for them to change, even though we know exactly what we must do to help our patients. Some of those hurdles are gone now. So the point is that we can provide more timely healthcare so we don't have to be burdened by, unnecessary steps where the doctor is going to agree with us for the most part anyways, because we know what we're saying and what we're talking about. Good. So that was a good kind of way or icebreaker to kind of think about what pharmacists already do. Some of you already know this. Here's another question for you guys. What's this symbol here? Can anyone tell me?
My first thought it's a green cross, but what does that mean? I'm not sure.
Right. So Any other thoughts? You guys can, either, and we have a smaller group, so you guys can talk here if you like, or,
Hmm.
well, do you see an animal there or any kind
Looks
of,
like a snake, yes.
exactly, good observation. There's a snake there and there's a bowl or a chalice or some sort of fancy cup. So in Ontario, every licensed pharmacy must have this symbol. Typically, it's a sign or a little kind of like display on the glass wall or something at the entrance. So this is a mandatory symbol that pharmacies must display in order for them to maintain their licensure. Okay, number one. So this little symbol is actually internationally one of the most recognized symbols of pharmacy. It's known as the bowl of Hygeia. I think I pronounced that correctly. Hygeia actually was the Greek goddess of health and hygiene, and the daughter of Asclepius, I believe, which the god of medicine, the Greek god of medicine. So this is like an international symbol. So when you see this, subconsciously, the nonverbals are given that this is a pharmacy, I can go in for some help. Okay, just a fun little fact. So, of course, pharmacists fill prescriptions, but we do more than just simply dispense your medications, right? Our primary focus is ensuring that every prescription that's filled is done safely, accurately, and appropriately. I'll give you a perfect example. It just happened yesterday. I'm not making this up. One of my patients came in and they had a tooth infection, a gum infection of some sort, and they needed it treated. They came in with a prescription for amoxicillin, very commonly used medication. However, my patient, because I know her and I had my records up to date, had a penicillin allergy. That's a problem. Amoxicillin is a kind of penicillin allergy. So I quickly and efficiently contacted the dentist, told him about the concern. We got it fixed up. Patient was good to go with the new type of antibiotic. There was not an issue. So this is something that we do, right? We look at drug interactions. Anyone know what a drug interaction is? Have they heard of that? I'm
Is
telling
that
you,
a,
your pharmacist is definitely looking at it.
Yes, when
is
a
that,
drug interacts with some of the prescriptions that you're taking and has negative effects.
Absolutely, great. Well put. So it's basically when drugs conflict with each other, basically, right? Some drugs, they're not meant to be taken together. And so that's why it's extremely important for you to have an up-to-date record. I will talk about this later, but you should have one single home pharmacy because unfortunately in Ontario and most places around the country, there's a bit of fragmentation, meaning that the systems are not all synced together. And so unfortunately, if you get one prescription filled elsewhere, it won't be seen readily at another pharmacy. Okay. So that's why it's important to have it housed under one system and one pharmacy. So yes, of course, we're looking at drug interactions, side effects, of course. And beyond that, we also provide information on side effects, how to manage it. So for example, if you start a new cholesterol medication, right? A statin, for example, rosuvastatin or Crestor, some of you may be on it. When patients are on it for the first time, and again, this happened yesterday, I remember, um, it's normal to experience myalgia, which is muscle pain. Now, if this becomes, an issue in this manner, or it continues to be an issue for this time frame, we would talk about red flags. So we would discuss that with you. This is what is routine when we get a new medication. Along with your prescription medications, I'm sure a lot of you go to your pharmacy to pick up over-the-counter medications. Over-the-counter, it basically means non-prescription, right? You don't need to get a prescription from your prescriber to get a bottle of Tums or even Tylenol or something like that. And also it's very important to check with the pharmacy or pharmacist rather, that just because you take it over the counter or it's a herbal product, it's not going to be an issue. Great example, turmeric. How many of you have seen turmeric in the pharmacy aisles in a capsule form? Curcumin, you basically turmeric. Have you guys seen that?
No,
Oh, sure.
Anyone know
Mhm.
what turmeric is used for in a capsule form, or what one of the uses are?
no.
Yeah, no problem. So
I think it's inflammation, is it not?
yes, excellent, very good. So it has anti-inflammatory anti-inflammatory properties. So in a natural way, some patients would like to, instead of taking, let's say, an anti-inflammatory like Advil or Motrin, they feel like, let me try turmeric in a capsule form that can maybe help me. If you're on blood thinners, that is a problem. That can actually interact with your blood thinners. So the point is that even though something is deemed as a natural product or a supplement, it's still considered a drug. It's not like we're taking a turmeric root and eating it, right? Then that'll be a different story. It's still refined and still processed, and it can have an impact. So even though it may be seemingly benign and safe, it's always a good idea to check with your pharmacist to make sure it's okay with your medications. Now, how many of you know what an extension is, or prescription extension? Maybe you've utilized this service with your own pharmacy or pharmacist. Anyone?
Well,
Basically-
when you run out of a prescription and for some reason you may be traveling, then you phone and you can get a temporary extension for a few weeks or whatever until you're back to be able to see your own doctor. Is that correct?
That is exactly very well put. Excellent. So a prescription extension is basically a power that pharmacists can tap into, where if you take a chronic medication, so what I mean by chronic is not short term or once in a while, it's every day. So when I say chronic, I'm thinking about your diabetes medications or your cholesterol medications or your antidepressants, for example, and so on and so forth. So these medications are well established. Your medical condition is not in flux, meaning it's stable. Everything is controlled. There are no changes, and you run out, or you're unable to see your doctor in time. Then pharmacists have the power to extend it for a limited period of time until you can see your doctor, or until we can get a new prescription or a refill, basically, right? It's a great way for you to maintain compliance. So that's what an extension is. An adaptation is a little bit different. As you can kind of tell from the word adaptation, which I'll go into a little bit later, pharmacists are able to adapt a prescription depending on the situation without waiting to hear back from the prescriber. Perfect example, very simple. Let's say for whatever reason, there is a shortage on 10 milligrams of a specific medication you're taking. However, the 5 milligram tablet is available. Now, most of the time, a pharmacist would just dispense 2 of the 5 milligram tablets to make that 10 milligram dose. But there was no documentation, there was no process in place. Now that there is, we can do it, and the doctor is looped in, and so they're aware of everything that we're doing. So again, the whole point of this is that it allows timely healthcare, so we don't waste time over things that we know what we're doing with, and ultimately that can help the patient. How many of you have heard of a MedsCheck, or have used or been part of a meds review or MedsCheck? I'm hoping everyone here at one point or the other. Probably. I'll talk about it in more detail. So a MedsCheck or Meds Review, which has been around for some time actually, is a government-funded initiative where pharmacists are able to sit down without any interruption, sometimes up to 25, 30 minutes, and we talk about everything. We talk about your current medications. We talk about anything over the counter. It's like almost like a kind of like a physical, but for your drugs. We do a checkup. We talk about your lifestyle choices. We talk about, like, why are you taking this in the first place? Is it meeting your healthcare goals? So it's just a fantastic way for you to spend a bit more dedicated time with your pharmacist and get the right information. We talk about even vaccinations. Are you up to date on your vaccinations? Now, that leads me to actually vaccinations and injections. That's a big thing pharmacists can do. I wouldn't be surprised if every single one of you have received either a flu shot, COVID shot, or both at your pharmacy. I hope we're right in the middle of flu season or the beginnings of the flu season, and so we are, really in the thick of the flu shot campaign, especially the COVID vaccine. So pharmacists played a huge role. There was something very small that happened in 2019. It's called COVID. It never happens in Shoppers Drug Mart Pharmacy. Okay. I knew this was going to come up at one point. So I'm just representing pharmacists in general. And yes, I know that there are going to be some disparities with certain other pharmacies, depending on what you experience. Hopefully you are empowered to actually request and understand what your rights are. Let's put it that way, okay? And honestly, and not for any other purpose other than everyone deserves good health care. Everyone deserves good service. It actually, if I could share something with you guys, it actually makes me a little sad when patients come to the pharmacy and they're just so grateful and thankful for the service I provide or my staff provides. But really in my mind, I'm like, everyone should be experiencing this. So if you feel you're not getting the due service, talk about it in a kind of polite way, like, I'm expecting this. Can we do something about it? So then maybe it's more proactive and more assertive from the pharmacist standpoint. Okay, another thing I want to mention here, minor ailments. That's probably the newest kid on the block in regards to services. It was a really big thing that the Ministry of Health was touting. Doug Ford was all about it. It's been going on for a year and a bit now. So I'll talk about them in more detail. And of course, along with these new things and services, pharmacists have been and should be providing health and wellness services, blood pressure checks, blood pressure monitoring, smoking cessation. So smoking cessation was something that we could do for a long time. It's not even just nicotine replacement therapy like Nicorette and Nicoderm, the patches. Pharmacists are even able to prescribe certain prescription drugs, right? And even chronic disease support. I don't know if you know this, but pharmacists now have access or can have access. They can sign up for blood work. So those of you that have diabetes, for example, hopefully everyone here knows what an HbA1c or A1c reading is. So when we do blood work, your A1c is a percentage that we can check with your blood work. A pharmacist has access to that. So I can actually in real time see what's happening with your medications. So that's another thing we can do. And of course, we have other cost-saving mechanisms, blister packaging I'll talk about, and medication synchronization.
Parag, I have a quick question for you.
Sure.
You mentioned MedsChecks. Approximately about maybe 2 or 3 years ago, my pharmacist with the Shoppers Drug Mart near my house, who's, by the way, excellent,
Great.
started calling me up or even catching me when I went to pick up my prescription, and he did a review of all my medication, filling out a form, maybe 1 or 2 pages long. And is that the MedsCheck that you're talking about? And I believe now the province funds this time that they spend on doing these reviews?
Yes. So great question. The question is, you went to the Shoppers Drug Mart and they reviewed your medication, made you sign some forms. Yes. So we need to get consent from the patient in order for us to do the review that you do indeed want it and that you request it. Now, without sounding controversial, the MedsCheck has to make sense. It cannot be for the sake of it. The resources, every dollar spent has to be used wisely, right? So now the government gives us these powers, it shouldn't be abused. So if there's a need for it, or if there's a request by the patient or the pharmacist feels clinically it's good to talk about it, or if you haven't done so, then do it. But the short answer is yes, that was what a MedsCheck is. Does pneumonia shot need to be renewed over time? Not necessarily. Usually it's a one-time thing. Now that's changed as well, and I'll talk to you about that. How often should the RSV shot be taken? Right now, at this point, is a single dose, and it provides several years of protection. They haven't talked about booster doses yet. Okay. Um, Now, what I wanted to just move on and say to you is that pharmacists don't or should not operate in silos. What I mean by that is that we're not independent in our little bubble. We have to talk to your other healthcare professional, especially when it comes to medication related information. We need to coordinate communication. How many times have you guys experienced a situation where a prescription was prescribed by your specialist and your GP or your family doctor may not be aware of it? However, the pharmacist sees a duplication or a drug interaction. It happens. So this is where it's extremely important for the pharmacist to be involved with your other healthcare professionals. It truly is a team, right? And the patient, you are in the center of it. We also support chronic disease management, diabetes, hypertension, and things like that. One of the things here I mentioned is discharge. So when we're discharged from a hospital, it just happened actually a few days ago at my pharmacy. A patient of mine, completely healthy, seemingly, came out a week later with 4 stents. So he had a heart attack and went in and came out with going from 0 or 1 medication to 6 or 7. So that's where we play an essential role in discussing the medication, especially at a time when it's a very new change for a lot of people. Okay, so the point is that we're part of the healthcare team. We already discussed a bit about the MedsCheck. So as you can see here, the Ontario government does promote it. It is a valuable service. It's anyone that takes 3 or more chronic medications. So if you take 3 or more chronic medications, you're eligible for getting a MedsCheck, and it's free, it's covered. It's oftentimes in person. It could be virtual, especially if you're unable to, leave your unit or house, or then that's an option too. At the end of the MedsCheck, after reviewing everything, the pharmacist can provide an up-to-date list, personalized advice. There could be follow-up after, and very importantly, correspondence with your doctor. So your doctor or your nurse practitioner or your primary care provider needs to be in the loop and be told that this medication review occurred and this is what came out of it. These are the issues we identified, and so on. Okay, so during a MedsCheck, you bring all your pills, every single thing, even over the counter items, and we talk about it. Literally, patients kind of line up all their little vials and their over the counter items and things they get from the health food store as well, like specialty supplements, traditional medicine, and we can talk about that. Again, the point is, and the goal of this is to make sure every medication is needed. Is there a reason for it? Could we discontinue it? Why are you on it? Some people take medications for years and they don't know why they're taking it. It happens. So that's why this is a way for us to recheck things. Yeah, so that's what the MedsCheck program is. Now, some new powers and services. So this is like the latest information that I wanted to share. Minor ailments. Again, I'll talk to you about it. I have another slide coming up. But we can actually in Ontario, pharmacists can do 19 or more minor ailments, such as urinary tract infections, pink eye, cold sores, some sort of dermatitis or rash, and many, many more. And actually, if you guys are keeping up to date with the latest news, come January, I believe, there's going to be even more minor ailments that pharmacists are going to be able to provide. Right now, we're in the consultation phase with the College of Pharmacists and the Ministry of Health and other stakeholders. But yeah, it's really taking off. And yeah, we'll talk about the next slide. We can administer many vaccines. So most of you know here that you can get your flu shot, you get a COVID shot. Now, did you know that if you had a prescription for, let's say, hepatitis A or B, like Twinrex is a vaccine that some people need when they travel, typhoid vaccines, even like shingles vaccine, Shingrix, a pharmacist is able to do it. Now, there could be a fee because pharmacists are not funded by OHIP in administering these vaccines, but that's a different matter. But pharmacists do have the professional ability to vaccinate you. Now, there's a very important difference I want to mention, or I guess consideration. This is just a service that pharmacists can provide. But if you're looking for publicly funded RSV vaccine or publicly funded shingles vaccine, you must go to your doctor's office. It's like getting a tetanus shot, for example. You would go to your doctor to get your tetanus shot. They get the vaccines directly from the ministry. So that's an important distinction. Sorry, is there a question out there?
Sorry, I just muted someone took a phone call. Go ahead.
Oh,
Parag.
sorry. Oh, okay.
No worries.
No worries. Thank you. So we talked about extending, we talked about adaptations, lab results, that's coming soon perhaps. And in the end, all of this helps support doctors. Okay. So, I mean, again, we work with everyone. I try to be as cordial and professional as possible. I mean, I cannot control my colleagues' sometimes opinions on things. However, doctors, and I believe that this is the case, they are being supported. It's not a turf war. And so sometimes, unfortunately, things are said to make it seem like we want to become doctors or we're taking over a doctor's job. That is not the case. And that is not what our intention is to complement and and free up time so that they're able to help you guys. So this is where minor ailments come in. Just say yes or no, or here's a question. In the upcoming pilot program, will pharmacists be able to prescribe a routine blood test, urine test, or even COVID test? Okay, great question. COVID tests we were able to do during COVID. So by the way, COVID was like a catalyst. It really took our scope and exploded. I still remember during COVID, we were open. The world shut down, but pharmacies were open. They're one of the few places, even your doctor's office or dental office, they were closed for a little bit of time. Pharmacies were always open. We were an essential service. And, I'm very proud to say that I was part of that. And, it was very, it was very alarming to begin with, and no one really knew what was happening. But the point is that we were able to do a lot of good came out of it, even though it was an extremely terrible time for the world and for Ontarians. During COVID, pharmacists were able to do COVID tests, right? We can even, at this point, I mean, it's not really done right now, but the point to your question is, are we going to be able to do routine blood tests and urine tests? I believe the government is exploring this option. Okay, other provinces are allowed to do it. Alberta is a completely different beast, if you're aware. But right now, it's not completely clear. And at this point, there isn't any kind of indication. Now, that doesn't mean that a pharmacy can do a cholesterol panel, or a pharmacy or pharmacist can do an A1C test. So there are some specific things we can do. And actually, for the urine test, you can actually get home kits too now. I don't know if you know this. So not completely clear yet, but they're definitely discussing it. With a show of yes or no in the group chat, how many of you, or just say yes, how many of you have used or got a minor ailment treated and prescribed by your pharmacy in the last month? How many of you, just to get an idea?
Not me, no.
Okay. Yes. Okay. All right. You don't have to mention anything about what it was, but just a yes or no whether you got a minor ailment. Anyone else? No worries. I just wanted to get an idea. So pharmacists can prescribe or give options for everything here. This is just an example. So it actually does 19 specific type of minor ailments. Now, what is a minor ailment? A minor ailment is something that is common, short term, and generally mild. Okay. it's also something that's easily diagnosed and treated. Okay. Now, I want to share something with you as well. Of course, pharmacists need to be knowledgeable on what they're doing. Everyone should be. And if there's even a doubt that they're not sure, they shouldn't prescribe anything. So after doing all the assessments and ruling out any red flags, even if the wrong medication is prescribed, the reason why these minor ailments were given or were chosen is because the harm or risk for mistreatment is very, very low. So if anything, even if we do something, it will help. That's the point. Now, I want to specify something. Urinary tract infections, it's lower urinary tract infections, mild urinary tract infections, and only in women. Now, everyone's equal, we're in free world, all that jazz. The reason why is because when men physiologically get a urinary tract infection, it's considered a more moderate to severe infection. So in those cases, you would need a more thorough assessment and the access to more stronger antibiotics that pharmacists cannot prescribe. So thank you so much. I appreciate that. I really do. Thank you. So yeah, these are just some of the examples of things that we can do. And the point is that let's say the doctor's office is closed, there's no other option, we can't get in touch with your doctor. This is an option. It's a weekend, you have the beginnings of a cold sore, you know exactly what it is, and there's nothing else to suggest any red flags. See, when I assess for minor ailments, you should be asked a series of questions. You shouldn't be just given a prescription. And just so you know, there are situations where it wouldn't be appropriate. And I tell patients, unfortunately, it is not appropriate for me to prescribe something for this minor ailment for such and such reason. And ultimately, always, you have to get the consent. So you have to always get consent from that pharmacist. And nice, of course, it's covered by OHIP. There's no fee for a consultation. Flu shots, hopefully everyone's getting it. COVID booster. Just FYI, I don't know if you know this. Before they were saying, 3 to 6 months, only when maybe there's an update. Now they're moving towards something that looks like an annual thing. Okay, it's fluid, and recommendations are always changing, but that's what they're suggesting now. So I know that recently there was a rejig of the formula of the COVID vaccine to better kind of track and match the current strains. So that's why the booster is very popular right now for those that want to get it. Shingles vaccine. How many knew what shingles are, or what is shingles?
Yeah.
Hopefully, yes.
Yeah,
Yes.
my dad had shingles.
People, it happens.
Yeah,
I have it.
I've had it. It's horrible.
You've had it. Yeah. Thank you for sharing that. It's not fun. And it
Not at
doesn't
all.
necessarily, it doesn't necessarily mean that it happens later on in life. If I can share with you, my own sister, who was in her 20s, she got shingles. So it can happen at any time.
Yeah.
However, there's a higher risk factor and uptick
Isn't it
after
part of
50
the chickenpox virus?
Yes, exactly. It's the chickenpox virus that's a kind of stayed dormant in our cranial nerves.
Right.
And something it's in our body basically, and something stimulates it.
Mm-hmm.
Right.
It is,
And yes,
it is highly contagious, I believe, and it very painful, affects your nerve endings, and the pain can last for quite a little while.
excellent. Yes, very good. So this is especially the case. So in the past, people used to have chickenpox parties. So basically children were just all herded together and they gave chickenpox to each other because it's very contagious. Now there's a vaccine in the childhood immunization vaccine that children get. So basically they've cut down chickenpox incidence in the population tremendously. Now, for those that have immune suppression or immunodeficiency, their immune system is shot, cancer patients, they're on certain kinds of medication, and they have maybe never had chickenpox. Those are the people that are very vulnerable to this. So we have to be very careful. Question here is how often should you get the Shingrix? So Shingrix is the name of the vaccine. If you guys recall, there was a vaccine 10 or so years ago called Zostavax. I don't know if you guys remember. That was the first vaccine that came out. Zostavax was not a good vaccine. It
No.
was 50% efficacy, which means that it worked 50% of the time, maybe even less. It was a single dose. Since Shingrix has been around, basically Zostavax is no longer around. It's as if it doesn't matter if you had Zostavax in the past, you should get Shingrix
Right.
if you're 50 plus.
Right.
Shingrix is a two-dose vaccination regimen. So you get, for example, 1 dose now, and then 2 to 6 months later, you will get your second dose. Now, what an important development is that Shingrix is covered now in Ontario for those 65 to 70.
Parag, when I
Yep.
got my Shingrix vaccine several years ago, it could only be given by my personal doctor. Are the pharmacists now going to be allowed to give the
So,
Shingrix vaccine?
so the question is, are pharmacists now to give the Shingrix vaccine? If you got a prescription from your doctor and you get it filled at a pharmacy, we can administer it. But if you're trying to get the one that's publicly funded, it's nothing to do with ability to administer the vaccines. You have to get it at the doctor's office. But let's say, for example, someone that's not eligible, they're beyond 70 years old, or better yet, they're 55. If you're 55, you're not able to get it from the government, right? But it's prudent to get the vaccine, especially you have the means or you have some coverage through private insurance, for example. Then the pharmacist can help you. The pharmacist at that point can administer a vaccine or administer the Shingrix vaccine to you.
I
hope
believe the
that-
same is the case for the RSV vaccine. You got to get a prescription and then your pharmacist can give it to you.
I guess you read my notes somewhere, but basically, the RSV vaccine, up until recently, is this year, they have now made it the same thing as Shingrix, but for those 75 years plus. But those that want to get it earlier, and they either have the means or they have a private insurance coverage, for example, then you can bring it to a pharmacy, the prescription, we order it, we dispense it, and we can also administer it to you if you like. The RSV vaccine at this point is a single dose. There is no information officially yet for any booster situations. The one that's been around for a while, which some of you may have already had, is called RXV. Sorry, my handwriting ironically is like a doctor's. So RXV, that's the name of it. There is another one called a Brismo. Yeah, it just came on the market. So
Parag, although it is given in a single dose, I believe it comes in 2 bottles, which the pharmacist has to blend together and then give you the shot. Is that correct? That's what I
yes,
have got.
yes. So the question is, it comes in 2 vials. So that's a matter of it being reconstituted. So the way that they're provided by the company, when we order it from the manufacturer or the wholesaler, they're given in 2 vials that we mix together, and that's called reconstitution. So we're just preparing the vaccine in order for us to administer it. So yes, that's correct. But it's only one vaccine. It's only 1 dose. As mentioned, pharmacists can administer it. There's a question here. Is there a newer version of Shingrix? If so, you would have, if you had it 15, 20 years ago, you need to update it. Okay, so there's no new update of Shingrix, but there's a newer shingles vaccine that's known as Shingrix. And the Shingrix is for those 65 to 70, it will be covered with OHIP. But if you want to get it earlier, which you can because it's officially indicated for those 50 years or older, you just need to get a prescription from your pharmacist, from your doctor or nurse practitioner. And actually, to be honest, there is some indication out there that a pharmacist can even prescribe it for you. But for, I mean, now we're getting a little detailed here, but in regards to insurance coverages and things like that, and actually in general, it should be something discussed with your doctor anyways. So you should get it from your primary care provider. Okay, so I'll come back to this. We have a Q&A at the end. So if there's any other questions about this, I'll talk about it, okay? How many of you know what this is? Okay, Actually, let me talk about that. I'm sorry. Thank you for asking that question. I didn't discuss the pneumonia vaccine. This is a big one too. So you might have got a pneumonia vaccine called Pneumovax. Pneumovax was a publicly funded vaccine at your doctor's office. If you were to ask your doctor now or your nurse practitioner now, they wouldn't give it to you. So what has happened recently is that everyone, even if they have never had a pneumococcal or pneumonia vaccine, they will get Prevnar 20. This is now funded. Before it was out of pocket. Now they fund it for you. We're pretty lucky in Ontario, I must say. I really must say we're very lucky, especially even other provinces. Anyways, so now one would get Prevnar 20, and no, you wouldn't need a booster from Prevnar at this point. Now, in the past, there might have been Prevnar 13 or other like versions of it that cover for less like kinds of the pneumonia or pneumococcal infection, but you don't need a booster per se. Okay, if you had the old government-funded one, the Pneumomax, then technically you should get the Prevnar 20. So you can talk to your doctor about that if you want to. Okay, but the nice thing is that 65 years plus is covered by OHIP. Thought I mentioned that. How many of you know what this is?
A daily medications block.
Excellent. AKA a compliance pack or a blister pack.
Yeah.
Yeah. So basically, it's a way for pharmacists or pharmacies to organize your medications so that you have an easier time in taking your medications, keeping track. So that's a service that we provide. Have your smoking cessation, blood pressure monitoring. If you go to your pharmacy, you can get your blood pressure checked. Most pharmacies do offer that. Some pharmacies are set up or with a travel clinic. And so if they've done some specialized certifications, they can give you advice on what vaccines and things you should get when you travel. Even simple things like home delivery. Medication synchronization is a very simple idea, but it's actually quite powerful. Basically, some people, they fill their medications at different times, right? Doesn't make sense. You're going every week to the pharmacy. You can actually ask your pharmacist to synchronize everything so that everything runs out at the same time, and then you can get your prescriptions every 3 months. So that's something that we can offer as well. How to make the most of your pharmacist. I really hope now, after everything we've discussed, you have an idea of, am I taking advantage of my pharmacist? Do I know my pharmacist? Do I know what their name is? So, as mentioned earlier, everyone should have a home pharmacy. You should have a family pharmacist, the one that you trust your family to go with, right? I believe in that. And so we actually follow patients along. It's a really nice feeling to see patients achieve their goals, to have as healthy outcomes as possible. When you see your pharmacist or your doctor and for a specific thing, just have a full list. Everyone should have a list on them, whether it's electronic on their phone or a piece of paper. It should be up to date every so often. It doesn't mean that you need to have a meds review each time or a meds check, but just have something so if someone asks you what medications you're taking, you know what it is. Understand what you're taking. Sometimes we become complacent, we don't really think about what we're doing and we're just so used to it. It's a daily ritual, but we're still putting something in our body. It has an impact. It's not placebo or sugar pills, right? What is the medication for? How long do I take it for? Are there side effects? What should I look out for? I mean, when you do a follow-up or like a review or a meds check like an annual with your doctor, hopefully you can talk about it then, but even with your pharmacist, make sure you do that. If there's any changes, update your pharmacist, okay? If you went to the hospital or saw a specialist, have a conversation. And of course, take advantage of the yearly annual MedsCheck. Don't be shy. We love answering questions, okay? Most pharmacists, at least. So in summary, we are the medication experts. We are your healthcare partner. We want to help you. Get your vaccines, understand what your options are. You have the options of looking into minor ailments as well for yourself, for your loved ones, or your friends. You know, there are some things pharmacists can do to make sure you don't go without medications in case you don't get to see your doctor. There's no harm in asking, right? Even if we're unable to, always ask. Build a relationship with your pharmacist, make sure they know you. And I want everyone here to, the homework I have is make sure you know your pharmacist's name and make sure you understand what your rights are and eligibility. So that basically is my presentation. And I'll just open up the floor if there are any specific questions that I can hopefully answer for you guys.
Oh,
Um,
thank you,
do you-
Parag, for that really informative presentation. Yeah. Go ahead, Nazma.
Do you run into a problem because the charge with OHIP for pharmacy is a lot cheaper than the doctors? So going to the pharmacy against going to the doctor, does that create a conflict?
Great question. So in regards to, so the services are separate, number one.
Yeah.
Okay. So if you need to see your doctor and then you see your pharmacist and for whatever service were provided, it shouldn't conflict and affect the patient in the end. So the recipient of healthcare, Ontarians, you guys, you will get the service and healthcare you require. Now, on the back end, just to kind of talk about this, everyone needs to practice with integrity and accountability. So unless there is a real wastage or unnecessary, because we don't want to do unnecessary treatment either. So if you don't need it, the pharmacist or doctor would say you don't need to do it. But in regards to a conflict with us at the pharmacy level, no, it won't have any impact in regards to funding or payment from OHIP or the government.
Thank you.
Parag, one quick question. It's highly hypothetical. Say I've been with a pharmacist at Shoppers Drug Mart for 15, 20 years, but I move my residence to somewhere far away, and now the pharmacy close to me is, say, Rexall. Is it possible to have all my records from Shoppers Drug Mart transferred to the Rexall pharmacy, or do I have to start from scratch?
Excellent question. So in regards to transferring prescriptions and files between pharmacy, first of all, it's all your own choice. It's the patient's choice. No one should ever force you to be or do anything you don't want to do. And this is a very common situation where you move and you want to find a pharmacy that's closer by, right? Unfortunately, even if you had a very good relationship, things happen and situations and circumstance change. So in that case, the receiving or your new pharmacy can always request a profile transfer. So they can request everything. And even if down the road, let's say after transferring most medications, something is left behind, the new pharmacy can always reach out to the older pharmacy and have a conversation and transfer that information. And it's always a choice that you have. So you can transfer across the country, actually, in any province. Question here, what's the difference between taking generic brand medications versus name brand medications? Does it matter what you take? That's a excellent question. So there are certain things at play here. First of all, a brand or originator medication is basically a medication that was first on the market. So a great example of this is Lipitor. Some of you know what Lipitor is. It's a statin or medication that reduces lipids or cholesterol in our body. And the active ingredient or the name of the medication is atorvastatin. Lipitor has been around for years. In Canada, drug companies have a limited time or a patent on those specific drugs. So they're able to market and basically sell their drugs under that name, and no one else can make another version of it up to 20 years. Okay. Once 20 years are up in Canada, then you have the option for other companies that are deemed generic companies that can actually make a clinically and equivalent generic version of that medication. Now, I want to stress something very important here. Just because a medication is generic, it does not mean that the quality is any less. And I'm saying this as a pharmacist, and I'm saying this as a clinician. I have talked to pharmacologists that work for Health Canada, and I know what the processes and protocols are. Generic medications, Health Canada on a federal level has to give the okay. Not just any Tom, Dick, and Harry company can make a generic drug. It has to go through rigorous kind of steps. Now, there are certain parameters that a generic company must fulfill in order for it to be deemed generic. But the point is that when you take either or, it would provide the same extent, rate of absorption, and clinical effect. Now, the reason why this is important to consider is that there is a law in Ontario where patients and the general public should be given the option of the cheaper generic option to save money. And 99% of the time, it allows for your your healthcare needs to be met. And this also represents huge savings for the healthcare system. As you can imagine, it is creaking and it is bending. And so every dollar saved efficiently is important. Now, that doesn't mean there are not specific rare situations where some people may be intolerant to a specific kind of generic. That can happen. It's rare. Also, some doctors may feel, based on specific reasons, for you to be on a specific brand. That's also the case. However, in that situation, then the patient would pay for the cost difference, whether out of pocket or with a private insurance or a patient assistance program. However, one thing I do disagree with is this indiscriminate idea that everyone should be on a brand name for the sake of it. That is my clinical and professional opinion, but I encourage you to have a conversation with your doctor.
Just to caution here, Parag, is if you insist on getting the brand name versus the generic, your Sun Life insurance, for example, with OPG, will not pay for it unless your doctor specifically says that you need that brand name drug. Otherwise, they'll only cover the generic drugs.
So there are, good question. There are hundreds of, if not thousands, of different kinds of insurance situations. And I have seen that in practice as well, where the doctor needs to indicate a specific reason by writing no substitution, if that's clinical. But even just taking a bigger step back, we have to think about why we're doing it. Okay, just FYI. Question here, travel in Asia, specifically Japan, what vaccination do you recommend? Okay, so what I would recommend you do, Michael, first of all, if you haven't already done so, is Travel Canada and the CDC website. Two great sources for you to, first of all, find out what diseases are endemic in that part of the world. The third thing I encourage you to do is perhaps look at what a travel clinic can do for you. So a travel clinic is where you have a travel doctor or someone specialized in travel needs, and then they could actually guide you as to what specific vaccines, medications you require. Moving on, I found even if the doctor said, okay, we still does not cover the increased cost. Yep, that could be the case because again, everyone is trying to, we have to think about how we're using every dollar, even from private insurance. Someone is paying for it, right? That's what I always tell patients. Yeah, your drugs are covered. Someone is paying for it. So it needs to be used wisely and appropriately. And there are also mechanisms in place where perhaps if there's a drug authorization form with some of these private insurance companies, they have that you can fill out. Any other questions?
Yeah, I have a question. You said who when you want to transfer between pharmacy, who is the one who initiates this profile, the new pharmacy or the current, the old one?
Good question. So who would initiate it? So first of all, I would say generally it would be always upon a request by the patient, but who would actually request the transfer would be the receiving pharmacy. So not for any reason, I'm just saying, for example, if someone wants to come to my pharmacy, then they would approach me to say, hello, I would like to come use your pharmacy. Can you take care of this? Do I have to do anything? No, the patient does nothing at all. So two things occur. So I would then contact their previous pharmacy and request the file transfer, and it should be on the phone. There shouldn't be any resistance. If you do develop any resistance, you should let that pharmacy know. Okay, I have seen that in practice, unfortunately. And the second thing is that you should inform your doctor's office that to say that this is my new pharmacy, because what happens is in this transition period is when you're getting new prescriptions, it's still sometimes sent to the old pharmacy. It just
Yeah.
wastes a
Yeah.
lot of time. So you just update your doctor's office.
And the renewal every 3 months. You guys do the faxing the doctor to get repair renewal done?
So great question. So the question is, do we actually initiate or fax or request that renewal? Yes. So pharmacies can do it. We can request it to anyone, really. And oftentimes it's fax, even though it's a kind of an archaic and ancient technology. But anyways, yes, we would then initiate that upon the request, or let's say you need it. Now, just want to mention some doctors' offices, they have this policy that they will charge patients for this service.
Yeah.
Yeah.
And they do that
They do.
because they are unable to bill OHIP. This is just a fact I'm mentioning.
Yeah, there's
So,
an we pay.
so just make sure you just confirm with your doctor's office that can we do this? And most of the time they're okay, because it's not like you're asking for a lollipop, right? Anyone else?
I
Um,
have a question, Michael. It concerns generic drugs prescribed. Weird thing is that I had reactions to it, and I was told that I had to go through 5 different generic drugs before the prescription for the
Brand.
non-generic but brand drug would be allowed. This is, quote, government policy. Was that correct? Is that true?
Okay. So the Ontario government has an option in place for those that have experienced a true adverse drug reaction, or ADR.
Yeah.
So if they've experienced a true ADR with 2, I'm not sure about 5. That's a little excessive in my opinion.
I thought it was excessive because after the 4, I didn't want to try it anymore, and I'm paying for the drug myself because Sun Life won't take it. Okay. I've been trying to find this out. Thank you.
Okay. Yeah. So actually, what you can do is public knowledge. If you Google Ontario ADR form, or on ODB, which is Ontario Drug Benefit, if you just Google ODB ADR form, is a PDF. In that PDF is the criteria that your doctor would have to fill out to say you've tried this, right? So as long as it's documented that you've tried and there's record of the 2 generic drugs, for example, you've treated and you still experience a clinically significant side effect, and there's no other options or alternatives in this category, and that you need this, it should be grounds for them to accept it. Now, the doctor has to fill out this form, and then they submit it to the pharmacy, and then the pharmacist can then prescribe it in that way. So the great thing of the internet is that a lot of information is out there. So I get it that we want to trust people and trust your pharmacist and pharmacy. I hope everyone practices with integrity, but it's always good to just double check yourself as well.
What's the name of the form again? The number?
It's ODB. I'll just type it in. ODB ADR form or something along the lines of that. So you can just kind of Google that if this is a requirement. Now, I want to mention also some of these brand name drugs, because the company that made the brand name drugs, they're losing market share. They have a lot of patient assistance programs. So a lot of pharmacies have it. Like I use it for some of my patients that, their private insurance is not covering it, but they cover enough of it. Let's say they have a preference. Then this specific patient assistance program covers a big chunk of that. And so this way, it's not a burden on a public healthcare system, and the company's providing this, and the patients are happy paying the little bit of a difference.
Parag, a question about you mentioned COVID tests, which hope we won't have to worry about too much anymore in the future. But I'm just asking, how would those be acquired? Am I right that we can engage the pharmacy, and would those be like? I remember at one point there was an in-pharmacy test where they did the swab themselves and evaluated it, or is the take-home test still a thing?
Yeah, good question. So they kind of turned the tap off in regards to um, pharmacists run testing. It's not needed, right? We're not in the pandemic situation anymore.
Right.
And so the pharmacists wouldn't be doing that unless there's a reason for it, or it's a fee for service, or some for travel purposes. I don't know. But the take home tests, those are still around. Not a lot of pharmacies have them, but there is a procurement system where a pharmacy that's part of the COVID-19 vaccine program, or they're able to get it through that. So it's not common, but you can find it if you really want. And actually, to add, you can buy it. So pharmacies are able to actually obtain COVID vaccine tests, even influenza tests, and even
Okay.
urinary tract infection tests, so on. I think that industry is really expanding for at-home service tests. So you can always purchase it. So you can talk to your pharmacy in that sense.
Okay, they can
Is there
either
any
have it in
financial?
stock or order it in, or
Yeah, we can order it in if needed. Yeah.
okay.
Just a question: is there any financials for which cancer? Okay, so specific question that you need to, if that's what you're just wondering about. Again, there are ways where, if it's catastrophic drug coverage, again, I just honestly, I'm not for any of this, is my own personal opinion, but we're super lucky to be in Ontario. There are mechanisms in place where you would then touch base with ODB, which is Ontario Drug Benefit, which is the government insurance program, or even Trillium, which is also part of ODB, which covers for those that are not 65 years older, and they need it. Then there's exceptional access programs where they cover some of these medications. But if it's experimental or something that's very new, that's not, even on the Canadian market or something like that, that is something that you would usually connect with the manufacturer of that drug company. And this is something separate from ODB or OHIP. They have their own patient compassionate programs that you can tap into. But then that's something led by your oncologist or doctor or the specialty clinic team, but directly dealing with that manufacturer. I think that is it, Colin, Nazma, would we say?
I think we covered all the questions in the chat, either as we went along or at the end here. This is great. Um, folks, Parag mentioned he's receptive to answering questions that come up later on. If you engage myself or Nazma, you can certainly do that through the Hydro Pensioners Toronto at gmail.com mailbox, and we can forward to Parag on your behalf, and he's agreed to respond to any of the questions. As usual, we'll have the recording of the event up in a couple of days on our YouTube channel, and I'll let you folks know when that is in place and ready to go. I want to thank Parag for taking the time to speak to us. This has been really informative. I think it's great that the government is expanding the capability of the pharmacists, so they're expanding our healthcare capacity to look after us all, especially as we're entering our senior years. So we really, it sounds like some good things are happening in our healthcare system. So thank you again for Parag.
No
And
problem. Thank you for having me. I really appreciate this. This was fun.
yeah.
Thank you very much. Thank
You're
you,
welcome.
Colin. Thank you,
Very
Nazma.
informative.
Thank you for, thank
You're
you.
welcome. You're welcome.
Yes,
Very
thanks
Very
a lot.
informative.
Very
Thank you.
Very
Thank you
informative,
very
for
much.
sure.
Good. Great.
Thank you.
Yeah,
Thank
we
you.
You're welcome.
definitely appreciate taking the time to explain things to us carefully. So
Yes.
it's great to learn all the new things that are happening in the province.
No problem. Well, I wish you guys all the best of luck. And yeah, if you guys are in the Etobicoke area, please come by. It's Medicine Cabinet. We'll
I've
be
asked,
really happy
I've
to see
asked
you.
for your, I've asked for your address, so send it to me, so I'll pop in Monday.
Sure, sounds great. I appreciate that.
Thank you.
You're welcome. Thank you so much.
Thank you, Naz.
Okay.
Take care,
Yeah,
Parag.
it was great.
Thank you. I'm glad you enjoyed it.
Yes, very informative.
Yeah. Anything we can learn, right?
For sure,
Yes.
for sure.
For sure.
Maybe we can have him on again another time.
Yeah,
Yeah, that's always a possibility next year.
yeah. An update.
An
If
update,
you-
of course, of course. This is what we are trying to do. We have a lot of things happening next year for different Zooms as well.
It was great.
Thank you. Thank you.
Thanks,
I'm glad.
thanks for, and thank you folks for participating. I thought it was a really good dynamic
you for-
conversation.
You guys, thank you. We really, I appreciate this. and I'm sure the rest of us do.
Yes,
You guys
I
put so much time
appreciate it
into this
too,
for
very
us.
much.
Thanks,
Thank you.
Thanks, Sheila.
You guys are doing great
you.
work.
Thank you.
Thanks,
Thank
Cynthia.
you. I'm glad.
Thanks
you
again. Nice hearing
Well,
from you.
We'll
Bye-bye.
we'll see you soon.
See you soon.
Yeah, take care. Bye.
Hey, Nazma.